Thank you for joining us. You are a part of an elite group who recognizes that Black women's health should be at the forefront of the national conversation. We are mothers, daughters, activists, entrepreneurs, entertainers, corporate warriors, and more, who help boost the economy and often drive the national conversation. For 38 years, the Black Women's Health Imperative has strived to amplify our voices, help enact policy that protects us, research our issues, create programs that enhance our lives, and produce events like this one to ensure we keep the conversation going about the issues that matter to us most. So, let's get started with our program.
And let's get started indeed. Welcome, everybody. The Black Women's Health Imperative continues. This is anniversary week, and we have got an exciting conversation for you this evening. We are talking about reclaiming our health as Black women, and I'm talking to tonight none other than the president and CEO of BWHI, Linda Goler Blount. Hi, Linda.
Hi, Jackie. How are you?
I'm excited to talk to you. Yeah, I really am. I think the work that you all are doing is so important. And I can't believe it's been 38 years. Can you?
It has been. I can barely believe it. So much has happened in the last 38 years with this organization, with Black women's health, with the conversation. And I couldn't be more excited than to have this conversation with you tonight to talk about reclaiming our wellness and being really at our best, because I think that sums up Black women when we think about our health.
Yeah, I couldn't agree with you more. And I want to keep it conversational with you. I know there's so much that people can learn from this conversation and hearing from you. But first and foremost, I just want to ask, sister to sister, how are you doing right now in this moment in your life? You know, as Black women, I've heard you say it on the stage all the time. We pile it on to our plates. We take on so much. And I know, being at the helm of an organization like this, you have a lot on your plate. How are you doing?
Yeah, and thank you for asking. I'm blessed. I'm doing fine. I happen to have 2 grandchildren, and I'm in New Jersey, so I get to see them as well as my 2 children as well. And there is nothing more fulfilling than to be with family, be with your tribe, be with people who are on your side, especially with all that's going on right now. It's wonderful to just fellowship with them. But then I come back to the women we're serving and the kind of stressors they're under, and hoping that, the work that we're doing, I know it's having an effect, but I'm hoping that our message gets through that we've got to take care of ourselves, that we've got to take time out, be with family, be with friends, be by ourselves, but try not to let the weight of all that's going on with the economy, with COVID-19, with all this uncertainty weigh on us and be too much. Because as you know, as a woman who works, things can get to be too much at times.
Yeah. And we got to learn how to self-care and take care of ourselves and make our health and wellness a priority. We talked about, and we're going to get to all of that. So you guys stay tuned to that, because we are going to get to self-care and wellness in this conversation. But I want to talk about BWHI. We talked about it being 38 years. This is the anniversary week. And I know that this organization's purpose and priorities and focus has evolved over the years, but I feel like your work and messaging is more important now than ever. Would you agree with that?
I really would. I think a lot has changed, as you mentioned, in 38 years. When we started, Billie Avery brought 2,000 of her closest friends together on the Spelman's campus to talk about how we should take care of each other, but most importantly, how we should take care of ourselves, practice self-care. And so that was very much the focus of the organization early on, and still is. But over time, things have changed. And despite all of the work that has happened in sort of medicine and research and even public health, in many respects, things are worse for Black women now than they were 38 years ago. Disparities, gaps are wider. And a lot of this has to do with, what we have access to and what we don't have access to. We've been focused on, as a part of self-care, chronic disease prevention, diabetes, heart disease, hypertension, making sure women live healthy lives, obviously maternal health, reproductive justice, and HIV. And of course, we're delivering our work through programs, but we're also in the halls of Congress from a policy perspective, helping with legislation, advocating for Black women's health, and talking about the importance of research and participating in research and what that means for Black women. But we've got to do so much more. This is a huge effort. And while we've made some progress, we need to make more progress, and we need to close the gap, because we can't continue having the disparity in breast cancer and cervical cancer and some of these other disease states that we have, especially when there's absolutely no reason for these disparities at all.
Yeah. I mean, Linda, are there moments where the weight of everything that's going on, not just with the state of Black women's health, but, with just COVID and how it's impacting the world and specifically the Black community, with racism, specifically in this country, does it ever feel like, I know for me personally, working as a journalist and reporting on these stories and covering it all the time, that can weigh heavily on you, being in the middle of all of this as you are, knowing what you know. Are you able to turn it off? Are you able to play with those grandkids? Are you able to or are you constantly saying, did you, to your kids, to friends, are you at the hair salon saying, did y'all get your breast exam? Did y'all, are you that girlfriend?
That's me. I am keeping up with folks. Did you have your well woman visit last year? People were afraid to go to the doctor because of COVID-19. A lot of women put off their well woman visits. They didn't get their physicals. And we're already beginning to see an increase in certain kinds of diseases, late stage diagnosis of breast cancer and cervical cancer, because we didn't follow up. We didn't get some of the treatments that we should have gotten, because for legitimate reasons. We were afraid. But I am that one who's always thinking about this. And I'll be honest, sometimes, being an epidemiologist isn't helpful. Sometimes I don't want to know some of these things, but I have to. And I'm looking at the data all the time and trying to figure out how we can take what we know, how we can take the data and turn that into actionable information for the everyday Black woman, women at work, but also corporate leaders and policymakers. It takes all of us. Black women's health is not only a Black woman's issue.
Absolutely. And as you will hear, my dog Oscar really wants to be a part of this conversation. He thinks he is so important. So when he does jump in and I will mute him so people can hear you, which is who they really want to hear more than me. So you'll see me mute from time to time. And that's just to drown out my dog. But yeah, I'm glad you mentioned that you're an epidemiologist, because I just want to talk about COVID for a minute here, Linda. I am vaccinated.
Good.
You know what I mean? Most of my family members are vaccinated, but I got to be honest, I do have a lot of friends, brilliant Black women, right, that are not. And when you think about our lack of trust when it comes to medicine, like, medical professionals, are they going to give us the best information? Are they going to give us the best treatment as Black women? When it comes to trusting the government, even the CDC and the missteps that they've had along the way with dealing with wear a mask, take it off, put it on. It's been so confusing. Yeah. What do you say to women, particularly Black women out there who are still hesitant? They're doing what they can to remain healthy and boost their immune systems. I have friends who, they have programs that, whole holistic programs that they're doing. What do you say to those women? Because I know you know the science.
Yeah. Well, I say do everything you can to be as healthy as possible. And you are right. Obviously, last year, the public health response to COVID-19 was an utter disaster. We just have to put it out there. And the then administration's response gave people every reason to be confused, to be wary, to be afraid, to mistrust. And that, frankly, just built on frankly, the historical mistrust that is quite legitimate in the Black community. So what we saw were significantly higher rates of infections. We saw more severe disease among the Black population. We saw longer hospital stays. We saw higher mortality rates. And some of this had to do with underlying conditions. A lot of this had to do with what we have access to and what we have had access to or not had access to historically. So it wasn't just last year. I mean, this has been hundreds of years in the making. So now we're on a certainly a better footing, but still the messaging is confusing. And you're right, having the CDC say mask 1 week and then the next week, well, maybe not, and then yes, but well, now maybe you should wear masks. And you add on top of that, different states are doing different things. We've seen obviously governors in different states argue against wearing masks, saying no, we don't need to mandate vaccines.
And you can still get the virus even if you have the vaccine.
And that is true. However, that does not mean don't get vaccinated. It means that you may get the virus, but it may not replicate in your system and it may not make you sick. You may be able to transmit it. We don't quite know, but you're much less likely to get sick. And when the vaccine was first made available, we made sure that we educated Black women on what it was, what this virus was, what this vaccine does. And we left it to Black women to make the best decisions for themselves and their families, because we know Black women will make the best decisions. However, with this new variant, it is serious. It is very contagious. And so now we've shifted where we're still educating women, but we're saying you really need to consider getting vaccinated because you want to protect yourself. If this is as contagious as they're saying, as contagious as chickenpox or more so, that means it will not take much exposure for you to get sick if you're not vaccinated. So if some people can't, they may have certain medical conditions that don't allow it. But if you can get vaccinated, do. And it's not hard to do. It is free. The local pharmacies, vaccines are widely available. If they're not, go online, go to the health department's website, call your physician, find out where you can get vaccinated, because this is really critical now.
And I know for BWHI, a big priority for you all, not only Black women, Black girls. And I worry about, school starting up, whether or not kids will be able to wear a mask. If there's a mask mandate, there's so much. How worried are you about Black girls in schools right now?
Still for young kids, the risk is much lower, and the risk for severe disease is much lower. I mean, yes, there have been some cases, but overall, the risk is low. It was interesting. I was reading a story with an interview with a middle schooler. And the question to her was, well, are kids going to wear masks? Is this not cool? Are you concerned? And she said, you know what? We have so many different designs on our masks now. It is actually cool to wear a mask. So I'm not concerned about the middle schoolers and the high schoolers. Even the young kids, even elementary school kids are, kind of into wearing masks. I am concerned if state and local leadership tells people not to wear a mask, or that leads them to believe for some reason that mask isn't protective. That really concerns me. But our children should be okay. Those school systems that are mandating vaccines, I think, are doing the right thing, as well as mask wearing, are doing the right thing to protect our children.
Yeah, absolutely. Linda, you said you're in New Jersey. I'm in New Jersey. It is storming here. This is why my dog is barking. I'm going to ask you a question, and then I'm going to step away and grab my dog so I can stop him from barking. And then I'll mute myself so you can just answer, because, again, people want to hear you, not me. But I want to know, as the head of BWHI, what did you all learn from COVID as an organization, and how did it force you, if at all, to reprioritize?
Yeah, COVID-19 and that whole experience was and continues to be extremely instructive. I mean, first of all, we learned how important health communication is. and what happens when it is not clear, when it is not based in data and evidence and science, and when you do not have authoritative leadership communicating the facts. We've learned how important the media is. We launched our own media campaign. We launched Black and Well TV last year to deal with the facts and the reality and the science of COVID-19. But there were a lot of competing messages out there. There were a lot of folks out there who were giving misinformation, who were confusing issues, and leading people to believe that the disease itself was engineered to harm us and that the vaccines themselves would harm us. We heard all kinds of stories from the vaccine implanting microchips so that we could be tracked, and just sort of doing other things that even to the point of mind control. So Jackie, as I think about that, what I've learned is, how important presenting the facts in a way that people can hear and act on them is critical. There's so much noise out there that we're competing with when we're trying to tell people the truth. And fortunately, we've made great success. The Black and Well TV was hugely successful. Our messaging, our social media has been really successful in giving the facts. And we're hearing this from Black women as they engage with us on social media. But again, there's a lot of competition out there, and there are people who are deliberately misleading, deliberately, frankly, just lying about COVID-19 and the vaccine. And so we've got to really step up our effort to counter those messages. And I'll just say one more thing. When the vaccine was early in its availability, there was a lot of conversation in the media, you'll remember, about vaccine hesitancy.
Yeah.
And I honestly think that while that messaging from public health officials was well-intended, it really was harmful, because there were a lot of people who would have gotten vaccinated, but there was so much conversation in the media about hesitancy. I think it actually discouraged a number of people from getting vaccinated.
Yeah.
There's always going to be the vaccine hesitant, but I think there were folks who didn't get vaccinated early on who would have, had there not been all of this conversation, all of this coverage in the media about hesitancy and why there was hesitancy, when in fact, early on, there really wasn't any hesitancy.
Yeah, absolutely. I definitely agree with that. What would you say, Linda? How could the media play a better role when it comes to helping to spread the message that Black women need to hear when it comes to improving their health physically and mentally? I know that the media can be a part of the problem and I'm a member of the media when it comes to not covering these stories, not putting enough information out there. What role do you think the media can help your organization and its goals?
Well, first of all, report the facts, report the science, check with people who know what's going on, who know the data, who know the science, ask them. Secondly, put the Jacque Reid on air every single day. Put the journalists who actually understand how to do research, how to have a conversation about data on the air so that they can convey the science and help people understand what is real and separate fact from fiction. I understand in media, we tend to sort of focus on what's sensational,
Yeah.
Well, COVID-19 is sensational. It really is. The fact that we had over 600,000 people die is sensational. The fact that we had Black people dying at 2 to 3 and even 4 times the rate of white people is sensational. And we need to talk about that, talk about why, and talk about it in the context of our lived experiences. Black women every day know about this. When COVID, think about a year ago, a little more than a year ago, we were considered essential. Nobody had given any real thought to Black women and their health.
Yeah.
Suddenly, we're essential. So we're the ones on public transportation. We're the ones who couldn't work from home. We're the ones facing an often unmasked and angry public. And we're the ones taking care of our family members and maybe even neighbors, which would in turn increase our exposure to COVID-19, because we're not going to say no to people.
Right.
So we could talk about the reality of our experience, living in the society, and what that meant for our risk for COVID-19 and our ability to avoid getting it or get the kind of treatment that we should get if we got COVID-19.
Yeah. Do you feel that your organization gets the attention from the media that it deserves and needs?
Well, we certainly do get attention from the media. I'm not going to say that we don't. We have great media partners. We have good friends who do come to us and ask us about, epidemiology, ask us about our programs, ask us about research and policy. But we need more. We need more friends in the media. We need more folks in the media to really understand how to talk about data and race and gender. Because sometimes what happens is we end up unintentionally, but we end up blaming the victim. The way we talk about Black women have 42% higher breast cancer mortality. Well, the way it gets covered in the media sometimes leads people to believe that there must be something wrong with Black women.
Right.
And that's not the case. We need to talk about the fact that in 1982, Black women and white women had the same breast cancer mortality rates. And then things began to change because in 1983, we learned how to detect breast cancer through screening mammography, and we learned how to treat it. And so that difference, that gap that we see, simply reflects who got access and who didn't. So we need the media and reporters to talk about our health in that context so that we don't lead people to misconstrue the facts and think that it must be our fault.
Yeah, absolutely. I know with a lot of my friends in the media and in the office where I work in the media, after the death of George Floyd, right? And there was this racial awakening across the country, and people were, just realizing oh my God, there's all this disparity, you know what I mean? And they would discover things like, how Black women were disproportionately underserved by the medical community. And it would be shocking to them to learn these things. But what disappointed me, Linda, was after a while, right, there was all this attention, people putting up black squares on their social media, leaning in, we want to do better, we want to be part of the change, there was a lot of it that was performative. And now, almost a year and a little bit longer after the tragic death of George Floyd, here we are, and I feel a lot of organizations are pulling back. A lot of people are pulling back and not leaning in like they did. Are you feeling that, or do you still see, and I hope your answer is you still see organizations still prioritizing, helping, and supporting what you're doing in that way?
So I too share that same fear and that concern that folks will just sort of be over it this year. We still have some very strong partnerships and partners. Folks are still leaning in, still being very committed to the issues. But I can tell you, last year, I've lost count of the number of people who said to me, I had no idea. Oh, I had no idea racism was such a thing. Or I had no idea health disparities were so significant. Or I had no idea they were related. And so you're right. Lots of statements went up on websites. People were outraged. CEOs were outraged at George Floyd's murder and that those of others. But I didn't see very many statements of here's what we're going to do.
Yes.
And so part of what we have to do as an organization and through our partnerships is to educate people so nobody can say, I had no idea anymore.
Yeah.
That's not, ignorance is not a defense, as you know. And we've got to make sure, and we are doing that through some of our newer initiatives, to make sure no one can say, I didn't know, but more importantly, to be able to say, now here's some things you can do.
Yeah. I was reading that Serena Williams, who, had a horrific experience when she gave birth to her daughter, nearly died, that she is donating a large amount of money to help deal with health disparities that Black women are dealing with in the medical world, and that OWN, Oprah Winfrey's network, is also contributing attention and time to the same cause. And I wonder if you feel like celebrity celebrity and money is enough, because I feel like a lot of times it's a lot of the work that you all do, meeting with legislators, meeting with people, and it's there. Those are the ones that have to make those kinds of decisions. Do you feel like celebrity, and that celebrities can add to or help this cause?
They can. I mean, certainly Serena Williams could highlight a
Yeah.
really critical issue in a way that most of us can't, because she is so high profile. I mean, she had a near miss that was really scary. And one of the reasons I think it's really important is because people might look at Serena Williams and say, well, she has access to the best.
Right.
Nothing could go wrong with her. And yet Serena Williams said, I had to get ugly for these people to listen to me. I'm a world-class athlete. Of course I know my body. I know when things are wrong, and yet people didn't listen to me. So you can imagine if the staff aren't listening to a world-class athlete, then are they likely to listen to sort of the everyday woman who's not well known? No. And this happens every single day. Mm-hmm. So it's really important to have celebrities put a face on the issue, to draw attention to it. But honestly, the real change is going to happen with policy. The real change is going to happen with programs that change provider behavior, that change the work experience of women in the workplace, that's going to change, how we are perceived, how we're treated, whether we're valued and respected and treated with dignity. So yes, we need both. We need those high profile personalities who can speak to the issues, sometimes from their own experience, and then we need the work on the ground in the state capitals and at the nation's capitals to make sure that we can eliminate the barriers and change the systems that led to Serena Williams' experience in the first place.
Speaking of state capitals and the national capital, let's talk about Black Women Vote, the National Health Policy Agenda for 2020 and 2021. Talk about the pillars. What were the key points of that for your organization, and how you think, we're almost at the end of 2021, which I cannot believe. I still can't believe it. Talk about how much you achieved, with that agenda.
I have to say that agenda, and it's actually in its second iteration. We released the first one in 2018. Has really been informative to help sort of focus policy efforts, not only for the Black Women's Health Imperative, but for our partners and for other organizations. It literally provided a roadmap for, what does our experience look like in the workplace? What kinds of policies around, maternal health and research and inclusion in, clinical trials? How important that is. What difference does this make to our experience? And so we've made progress. Obviously we've got a long way to go. A lot of that legislation, particularly around maternal health that you mentioned and others, has yet to be passed. Mm-hmm. I'm more hopeful with this administration than that can happen. But it literally lays down the roadmap for what needs to be done and then connects that to health outcomes. We know, for example, if we had health insurance, if we could increase screening mammography rates, if we could increase cervical cancer screening rates, we could cut the breast cancer mortality, we could cut cervical cancer mortality. We know that if we actually had the kind of training, anti-bias training that is called for in legislation among medical staff, we could cut maternal mortality rates. So it really is a blueprint for what needs to happen. And we will be working and have been with the Congressional Black Caucus and other members to try to get this legislation passed and to get the legislation in the agenda passed. There are many different bills that we need to look at, from uterine fibroid tumors, all things Black women's health. And of course, it's also connected to things like pay equity.
Yes.
If we made more money, then we have health insurance. We know the role that wealth plays in health. So these things are really intricately related. And if we can get the many bills passed, it would be huge. We'd see many, many fewer deaths. And I can just tell you, just as a statistic that keeps rattling around in my head, that 50,000 Black women die needlessly every year. So if we just had the legislation, that would save lives.
Yeah. Take us behind the scenes of the work that you all do when it comes to working with policymakers. Are you all up on the Hill? How do you take us, backstage of BWHI? How does it all come together? Because people will hear about this organization, or they know about it and they think, well, you're having the conversations that you're having the seminars and the programs that you're having talking about, different issues related to women's health. But I think a lot of people don't know the work that you're doing with policymakers. Take us behind the scenes of how that works, because it's a big part of what you do.
It is. We have a tremendous policy team. It's led by Tammy Boyd, our Chief Policy Officer. Last year, we weren't meeting, obviously. But prior to that, Tammy and her team and I were frequently in meetings with members of Congress and with their staff, helping to advise them on the science, the data to inform legislation, working with them on bills and helping them understand what Black women need, sort of connecting that policy to health outcomes. Over last year, obviously, our meetings were virtual, but we've been in a number of meetings with members of Congress. The Congressional Black Caucus is, a very close partner. So we, have met with Congresswoman Robin Kelly and Bonnie Watson Coleman and Yvette Clarke on very specific legislation, but also educating their teams on the role legislation can play in Black women's health and what the key Black women's health issues really are to help them sort of orient their work. So I'm looking forward to when we can actually meet in person again, but coming up in later this month in September, we have more meetings scheduled. And, I can tell you that the members of Congress and senators also understand these issues. They're pushing for legislation. They've developed legislation. We just need to get it passed.
Yeah.
So we're doing that work at the federal level, but also the team works in various states. I mean, we worked in Alabama on cervical cancer legislation, again with Congressman Sewell, but it was focused on Alabama. So we lend our policy support, our policy analysis, and our efforts at the state level, but also at the national level, but also at the state level as well.
Yeah. Getting these policies, passed and helping them to become laws to really make big change really boils down to us getting out to vote. Particularly, we know the power of Black women and our vote. But Linda, I gotta tell you, I'm worried about midterms. I'm worried about the next presidential election. I'm worried about will we have the numbers because of the last administration that just seems to be just haunting us. It just the power behind the popularity behind that administration and what they stood for seems to just still be as strong as it was when he was in office. Do you know what I mean? I try not to say his name because I just want it to be over, but it's not. And so I have to be honest and say I am worried. You know what I mean? I'm worried that, when it comes to midterms, that we may lose the voices and the advocates that we have now that's pushing for these things that you're working. So, I mean, we barely have enough votes to get through the things that we need to get through now.
Right. I mean, it's still a struggle, as you said. I mean, we're not there yet.
No.
As terrible as COVID-19 has been, I hope that, to answer your previous question, that it serves as a lesson to us all about what can happen when you don't vote. And so we can't lobby, we can't endorse candidates. Obviously, we're a nonprofit and nonpartisan, but we can talk about what happens when certain legislation is enacted or when it isn't. We can talk about what barriers can be addressed through legislation and what that means for Black women's health, what that means for mortality. And so, I too am concerned about what's going to happen next year, but I hope that people will remember this moment in time next year and think about where we are now. Hopefully we'll be in a much better place a year and a few months from now, but really think about where we could be if we hadn't voted last year.
Yeah.
So I hope that is the driving factor, and we will do everything we can to help people understand the connection between health and voting and frankly, avoiding mortality. I mean, it is a life or death issue.
It is. It's all connected, as you just said. Another campaign that I love that you all do, which is so important and people really take for granted, is the Positive Period campaign. You know, it may seem like, especially to men, it may seem like it is not a big deal, but making those supplies free, are we any closer to that just becoming a reality?
Well, we are doing everything we can. We have our Positive Period program where we are literally distributing menstrual supplies. And, you know, for a lot of people listening, watching, they may think, really? Do we really need that in this country?
Yeah.
But just in Atlanta alone, you know, there are some statistics that suggest that for some young women in low resource schools, they may miss 1 to 2 days a month because they don't have menstrual supplies. I mean, we've already heard stories of mothers making daughters use other kinds of things for when they're on their period, because these supplies are really expensive. And in some states, so grab on to something when you hear this.
Oh boy.
In some states, menstrual supplies are not considered basic necessities and they're taxed as luxury goods.
Wow.
Which makes them really unaffordable. And so by missing 1 or 2 days, that's actually enough to derail a young woman's education and keep her out of college and keep her out of a good job. So we're trying to address menstrual insecurity by highlighting these issues at a policy level.
Yeah.
Because again, we've got to take a policy approach, but also making sure that young women have these supplies, menstrual cups, tampons, pads. We've got great partnerships to distribute these supplies so that we can keep women in school, young women in school, and make sure that their education is not derailed.
Yeah, it's so important. Speaking of young girls, they're dealing with so much. Young Black women right now, young Black girls, I should say, dealing with so much. And I know it's an important part of what you all do, Black women, but also Black girls. What's a priority for BWHI when it comes to Black girls right now?
Yeah. You know, I would say our number one priority for girls and for women, frankly, is stress, is mental health.
Yeah.
We, a long time ago when I first started, we asked Black women to define health. And we just said, you know, it was a qualitative analysis. Just give us words and phrases. You know, what does health mean to you? And about 85% of the words and phrases Black women used to define health were psychosocial. Like, you know, I'm calm, I'm at peace, I'm in control. About 10% were financial. You know, I keep a roof over my head, take care, you know, pay my bills, take care of my kids. Only about 5% of the words and phrases that Black women used to define health had anything to do with physical health or disease state. So we changed all of our work to start with, how does it feel to be a Black woman in this society, in this moment in time, and go from there. Stress is serious. I mean, we're seeing now, the research has been out for years, but we're seeing the effects of what we've been studying for 30 years, this so-called state called weathering. Arlene Geronimus talked about this 30 years ago, where Black women and girls are literally aging faster because of the effect of racism and gender discrimination. We see it at the DNA level, which causes us not only to age faster, but triggers our inflammatory response or metabolic changes. So the Black Women's Health Study found that if you give Black women and white women the same high-fat diet, we will gain more weight and gain it faster. If you give us the same low-fat diet, we'll lose less weight and lose it more slowly. So this whole obesity conversation ends up, you know, blaming Black women, when in fact, our bodies are responding to incredible stressors. We have 15% more cortisol in our bloodstream at any point in time, which is a stress hormone, than white women. So all of this raises our risk for these kinds of conditions and makes it more difficult for our bodies to respond in a healthy way, because we have this kind of stress. So we're really focused on trying to understand what that means. We have a lifestyle change program called Change Your Lifestyle, Change Your Life, which grew out of a diabetes prevention program. But we start with let's talk about stress. Let's talk about, if you're not eating in a healthy way, let's talk about why. If you're not able to exercise, let's talk about why. Let's talk about what role your emotions play in what you're trying to do with your life. And it is really important. And now, with the racism of last year on video, seeing people killed multiple times, COVID-19, you started out with it's a lot. That's our technical term. It is a lot.
Yeah.
And so we've got to take care of our emotional health before, honestly, we can take care of anything else, because these things are so closely related. And if we don't take care of our emotional health and our daughter's emotional health, then we're in for it. And so that's why we're focused that way, so that Black women know it's not their fault, they're not to blame, and that they're valuable and worthy because they did one thing. They woke up. That's all that's necessary.
Yeah. I was frustrated and angry when the tennis great Naomi Osaka and then Simone Biles more recently at the Olympics announced that they were taking a step back because of mental health issues. You know what I mean? They needed to deal with what they needed to deal with. And the criticism that they publicly received, both of them, made me angry. But I was also proud of them for stepping forward. But I noticed that a lot of Black women came to their defense.
Yeah.
And I just wonder if you're seeing, Linda, that Black women are getting it, that was almost like a wake-up call, or more and more of us are saying okay to therapy, or okay to self-care, okay to taking care of ourselves when it comes to our mental health. Are you seeing that shift?
Yeah, we are. The conversation is definitely changing. More and more Black women are talking about being vulnerable, and that it's okay to be vulnerable, that it's okay to ask for help. It's okay not to have it all under control. And we say, take the cape off. Yes, we're all super women. We don't have to be super women all of the time. Mm-hmm. We can ask for help. And to quote our founder, Billy Avery, no is a complete sentence. I say use it early and often.
Yes.
Because we take on so much. And part of what we do, perhaps, inadvertently, is we then lead people to expect that we will continue to do that. And we see it in the workplace all the time. Black women work on average 20% more than other people in the workplace for no benefit, no greater promotion, income, salary, nothing. It just takes its toll on us. But we do it because we think we have to. So I'm hearing from more and more Black women saying, you know what, I'm not going to do that anymore. I'm going to take care of myself. I'm going to work a reasonable schedule. I'm going to take breaks. I'm going to talk to my friends about what's really troubling me. When my girlfriend says, hey, how are you doing? I'm going to stop saying I'm fine when I know I'm not fine.
Yeah.
And I'm going to be open and honest. And as I said, be willing to be vulnerable. We have to. That is self-care. And that is courageous. And only fearless people can do that. And that's what we are about our health.
Yeah. I think we also need to, you tell me what you think, find a better way to celebrate and gather and self-medicate. I think that we lean into, food, it is a drug, it's comforting. I think alcohol, listen, I love a glass of wine, but I feel like when we turn to it too much, that it can be damaging. Talk a little bit about your thoughts on that and the way that Black women lean into those things as a way of comfort and self-medication.
Yeah, we all do. We all try to find comfort. We all try to find means of dealing with our stress.
Yeah.
Drugs, alcohol, food, other things, shopping, spending money.
Yes.
Part of this, our program, Change Your Lifestyle, Change Your Life, is actually to look at those behaviors, really examine them, and understand why you are engaged in them and what you think you're going to get out of them, and discover, oh, in fact, I'm not really solving the problem, and I'm not really being comforted for a long period of time after buying those dresses and those shoes, or eating the whole pizza. And
Now
so
you're talking about me, Linda. Okay,
well,
now come on now. Come on.
okay, for me it's potato chips. So
With hot sauce.
Ooh.
So good.
So this is really helping us to look at what's driving us
Yeah.
and make different choices that are really healthy, and making different choices about food, about exercise, but about other things that bring us comfort and joy, that are healthy for us and not to dull pain. Because that's really what we're trying to do. We're trying to deal with our stress by dulling the pain of our lived experiences instead of finding the joy in them. And I understand what I'm saying is easier said than done.
It is.
But that's where we've got to be. And that's why we talk about being with your tribe, being with your friends, being vulnerable, surrounding yourself with people who have your best interest at heart, helping people and receiving help, and staying away from the toxic folks that we all know who never seem to have a good thing to say about anybody. Be around different people that actually feed your soul. And if you can feed your soul, then you don't need the other things.
Yeah. And how do we get, I think about food deserts, and I think about, not having healthy, I'm a vegan. So, I'm always aware of, when and where there are fruits and vegetables around wherever I am. How do we make healthy eating more accessible to all people, particularly Black women, in low income neighborhoods?
Well, I would say, definitely go to our website, go download our app.
I know you have the information.
Where there's lots and lots of videos and information on how to cook healthy, even on a budget, or especially on a budget. Yes, some people do live in food deserts, but even so, you can get access, if not fresh fruits and vegetables, frozen fruits and vegetables. You don't want to eat anything out of a can if you can avoid it. But there are lots of strategies and tips and information, like I said, videos, to help you do that, to help you learn how to eat in a more healthy way without, breaking the budget, and, kind of keeping that up for your family. We've got participants who have told us incredible stories about how their lives have changed dramatically by making simple changes around how they cook and the kinds of foods they choose. So it is possible, but you do have to be intentional about it. You've got to be diligent, but you've got support. The Black Women's Health Imperative is there for you.
Yeah, I love hearing that, because I have so many conversations with relatives, girlfriends, who just really don't understand. They really just haven't put the time in, because the information is out there, but they really haven't leaned into it, because that's not how they were raised. That's the one thing I hear more than, I was raised up on this food. I'm gonna eat. This is how I learned how to cook. That's the main thing I keep hearing.
Yep.
But we've got to lean into a better, healthier way for the sake of our lives, and we have to pass those new traditions down, right?
We really do, and I know it's hard. I mean, I'm not going to pretend like it isn't.
It's hard,
but it has to happen. It is all we have. How many of your friends do you know who have parents or relatives who might have diabetes or hypertension, had a stroke, had a heart attack? I am not blaming anyone, but we've got to change the way we approach food and the way we use food. That we've got to change our approach to exercise. You don't have to go to the gym. It's not necessary. You don't have to buy a gym membership.
Yeah.
But this is where these issues intersect, because if you live in a community where it's not safe, if you're working 2 jobs and you come home and it's 10 o'clock at night, no, you may not get outside and walk. So we've got to come up with other ways, other mechanisms, other solutions to help all women be as healthy as they can. And we're doing that. We're absolutely doing that.
You're seeing the results.
Mm-hmm.
You're seeing the results. Yeah, I also would love to see, one of the things when I became vegan, at the time I was having issues with my knee as a runner. I was having runner's knee. I think it was just early arthritis. And then, I was having issues with my feet, bunions. I was having pain, couldn't wear heels without, giving some time for the pain to adjust. Couldn't walk up and down stairs without feeling some kind of pain, not excruciating, but, a pain nonetheless that made it uncomfortable. And it got to the point where I said, you know what? This is going to be my life. And I feel like so many of us accept pain. We accept back pain and knee pain and things like that we don't have to live with just by changing the way, just by changing habits. And I know that's a big part of, what you all are working towards, changing the way that we think about food and about what healthy living is. Like you said, exercising. You don't have to go outside. You can just walk in place inside your home, and that counts.
It does. And diet is just critical. As hard a conversation as that is to have, you're talking about pain. A lot of us have some kind of inflammation, whether it's back pain, knee pain, hip pain. We've had many, many folks say, I changed my diet. I started eating more foods, that blueberries, blackberries, red peppers, yellow peppers, things, with lycopene and antioxidants in them. And suddenly I'm not in as much pain. They're not taking drugs. They're not taking, pain relievers. They're doing it through diet. So it is possible, but you do have to be diligent. And I understand, and every now and then you have some potato chips. That's not going to hurt you, but it is a commitment to a lifestyle. But that lifestyle will save your life and that of your family.
It is so worth it. I have to tell you, since I changed the way that I eat by going vegan, cutting out dairy and things like that, which causes inflammation, my bunions don't hurt no more. My knees feel good. You know what I mean? It really made a difference just for those who are thinking about leaning in that direction. I want to go back to this, though, Linda, the disparity when it comes to dealing in the medical world, going to the doctor, going to the hospital. What advice would you give to women for advocating for themselves? Because now they're talking about giving us this booster shot if you have had the vaccine. They're saying, hey, if you have any questions, talk to your doctor. You know what I mean? How do we advocate? And then if you do end up getting COVID and you have to go in the hospital or you're dealing with something else and you have to go to the doctor, second opinions, like how do we learn how to advocate for ourselves? And I feel like you have something on your website on this, probably.
And we do. If people go to bwhi.org, they will find lots of information. But this is a really, really important question because we often are raised to be very respectful of authority, not question authority. So many of us go to the doctor says something, nurse says something, we leave, we really don't know what they said.
Yeah.
And therefore, we can't act on it. That's one. But two, we have that experience where we go to the doctor and the doctor or the nurse does not treat us with respect, is rushing us out, not explaining thoroughly. We're trying to ask questions and we feel like we're being rushed. So that is really what we're talking about when we say, advocate. I like to put it in really simple terms. You would not take bad service from the cable repair guy. Don't take it from your doctor. If you can't get your doctor to slow down, to stop and explain things the way you can understand them, get another doctor. There are plenty of them. All of this experience with the medical system starts when we walk in the office. How does the front office staff greet you? And they send a very clear message about what your experience is going to be like from the very beginning. And this is a partnership. If you're seeing a physician, if you're having an issue in particular, or if you're just going for your well woman visit, it's a partnership. You want that physician, you want that nurse to be on your side, to do everything they can to keep you healthy, and to, if you're getting treatment, make sure that treatment is effective. And if you don't feel like you're being respected, you're not going to do well at all. And so we have information on how to advocate, but we're also working with researchers and clinical trialists to improve the clinical trial experience, because part of what becomes evidence depends on who's asking the questions and who they're asking. Right. And if we don't participate in clinical trials, if we don't have researchers of color, if we're not funding the issues that are important to Black women, then we never get evidence-based medicine. And so we've got to make sure that we're included in the evidence. And I'll just give you, a quick anecdote.
Yeah.
The U.S. Preventive Services Task Force wants to raise the age to start looking for breast cancer from 40 to 50.
Yeah.
Well, they talk about, we're following the data, we're looking at the studies, and yes, they are. The studies are out of Sweden and Canada. There are no Black women in them. So if Black women get breast cancer on average 5 to 7 years younger than white women, why would we raise the age at which we started looking for the breast cancer? So it's that kind of thing. This is why our participation in research is so important, because otherwise we get evidence-based medicine and therapeutics applied to us, and we had nothing to do with the creation of it in the first place.
Yeah. To the best of your knowledge, are we involved in trials and such when it comes to COVID and vaccines and things like that?
The representation for the COVID-19 vaccine trials was excellent and far better than we've seen in just about any other therapeutic area. So they got the message, Pfizer, BioNTech, and Moderna. J&J has a little bit less, but still better than average. And so we're also keeping up the pressure to make sure that these researchers and trialists know how to do this, know how to do the outreach, and know how to not just include people of color and Black women in particular, but include them in a way that their experience is respectful. Because the number one reason why Black people don't participate in clinical trials is because nobody asks them. It's not that we have an aversion to them, but if we don't know about it, we can't participate.
Absolutely. I want to tell a quick story just about advocating for yourself. Years ago, when I had an issue with my back, I had a herniated disc, and I went to this, orthopedic expert and he, specialist, and he was like, let's get you on the schedule for back surgery 2 weeks from now. And it was a rush. He wanted to get me on the schedule, and he said to me, you don't want to be a back cripple. That's exactly what he said to me. And I was just like, well, you know what? I'd love to get a list of the patients that you performed the surgery on. And I called, it was years ago, and I called every patient. He gave me about 10 patients, called them all. Everybody still had an issue with pain after having that surgery. I never had the surgery and went to great therapy. I've trained for 2 marathons. I work out on a regular basis. But the doctor was trying to push me, just like they try to push Black women into having hysterectomies and all types of things. We have to advocate for ourselves.
Absolutely. Good for you. Good for you. Everyone should follow your example. Always get a second opinion, get a third opinion. Just do your homework. I'm sure he meant well.
Yeah.
He was going to do the surgery. That's what he's trained to do. But surgery is not always the best option. And, there's that saying, once a back patient, always a back patient.
Exactly.
So do what you did. Advocate, say, you know what, I need to slow down. I need to get some more information. I need to talk to your other patients. Let me do my due diligence and I'll come back. And maybe not. As you did, you found another approach that has served you well.
Yeah.
So, congratulations. I'm really happy to hear that.
Never saw him again. Never went back. But but doctors are people too. You don't know if somebody's having a bad day, if they're rushed, if they're overworked, if they're stressed out. You never know what they're bringing to the table when you come in that office, when you meet with them. So we have to be careful. I know that they wanted us, Linda, to take some questions, but I don't know if that is still happening. I know we have 2 minutes remaining, well, like less than that. But I just wanted to just talk quickly about the next 38 years of Black women's health imperative. What do you see? What's your hope?
Yeah. So I am really excited. There is so much going on. Sort of one of our next big initiatives is a big anti-racism campaign where we, will help everybody understand the connection between racism and gender discrimination and health outcomes, and the need to change the language that corporations, foundations, everybody uses to talk about race and gender and health, so that we're looking at this from a historical context and not, blaming Black women. I'm really excited about what we will see in the workplace, how we will see policies in place to improve our health and protect our health, most importantly, and that we're going to have this generation of young women coming up who are going to know advocacy, know how to know the importance of voting and be in the trenches on the ground, advocating for their health and helping others to know just how important it is to protect our health and doing the work. So I'm looking forward to, I probably won't be around the next 38 years, but I'm looking forward to what's going to happen in the next few years, and having the kinds of partnerships and folks on our team, people like you in the media, Jackie, who understand how important this is to help get this work done.
Yeah, absolutely. Well, Linda, it has been just a complete joy talking to you, learning from you. I learned so much in this conversation, and I know everybody out there watching did as well. So thank you for this. Thank you for the work that you do with BWHI.
Thank you so much. Take care. Be
You
well.
too. And thank you all for joining us for this conversation on reclaiming our health as Black women. I'm glad we did this.
Yeah, me too.